Hello everyone, my name is Ashish Rahi and today my topic is about the hormones and hormones antagonists. The hormones are the substances which are secreted by special type of cells that is called gland and are poured into bloodstream directly and transported to the action tissue. Thyroid hormones are released by thyroid gland and regulated by TSH, and there is thyroid hormone T3, T4, calcitonin physiology increase basic metabolic rate, growth and development of brain, and action on vitamin metabolism, action on body temperature, action on growth, and action on body weight, and action on sexual functions. They increase the appetite, changes in menstrual, restless diarrhea, excess sweating, sleep problems, swollen thyroid gland. Clinical use are natural and synthetics, hypothyroidism, hydrothyroid, coma, cretinism. Antithyroid drugs are the drugs which block the formation of thyroid hormone. It increases the vitamin D production, which increases the absorption of calcium from intestine to maintain blood calcium level. The pathological role are low level of parathormone increase the hyperparathyroidism and increase the phosphorus level high production of parathormone increase hyperparathyroidism. Symptoms of acute hyperparathyroidism is hypoglycemia, tetanus, tingling of left hands and muscles. Symptoms chronic are loss of hair, brightening fingernails, nails, caries of teeth, cataract, and parathyroidism due to hyperparathyroidism. Calcitonin is also a hormone. And vitamin D is also a fat soluble vitamin. It is a pre hormone which is converted to body into number of biological active metabolisms and they function as true hormones. Also, vitamin D are food and exposure to sunlight, increase the intestinal absorption of calcium, promote reabsorption of calcium, blood calcium level, and promote mineralization of bones. Vitamin D deficiency causes symptoms like acute larger amount or long-term use of vitamin D causes hypervitaminosis. It is used for prevention, treatment of gas and osteoporosis. It enables lipolysis and decrease plasma glucose level. And pathological roles are low secretion of insulin and complete absence or resistance to insulin action indicate hyperglycemia and causes many biological problems, diabetes, myocardial infarction, abnormal blood level, hereditary hypertension, weakness of immune system, and high secretion of insulin goes to treat type 1 diabetes to treat diabetes ketoacidosis and diabetic coma. So this is the hormones and the hormones antagonist role in our body. Thank you.